Hi, it's me again, Dr. Renee, and today we're going to talk about COVID and asthma. Now, you know that's a very hot topic right now, so if you want to know what is the correlation and do you need to be worried as an asthmatic with having COVID, you want to watch this video. You guys, you know I am Dr. Renee, but I want you to talk to your doctor about your asthma and how to take care of it and make sure that you're safe from everything that's out there, including COVID. This information is information for you to be able to take to your physician and ask questions and listen to what they have to say and make sure that they have you on the right protocol for your asthma. Okay, today we're going to talk about COVID risks with asthma because you've heard about COVID and all sorts of diseases. Let's talk about asthma and COVID. Now, according to the CDC, people with moderate to severe asthma may be at a higher risk of getting very sick with COVID-19. COVID-19 can affect your nose, your throat, your lungs. It can cause an asthma attack and possibly lead to pneumonia and acute respiratory disease. People with asthma are more at risk for COVID-19 complications because they already have damage to their lung tissue and overreactive airways sometimes. So COVID-19, if you don't know, is a type of coronavirus, which are a large family of viruses that commonly circulate among people, usually causing a mild to moderate upper respiratory tract infection, which is basically common cold. This particular coronavirus strand, COVID-19, which stands for Coronavirus Infectious Disease 2019, because that's when it came to be, this particular strand they call a novel coronavirus. And why do they call it novel? Because it's never been seen before in a person until now. So what does that mean? That means there is so much that we don't know about it and so much that we're learning every day. But what we know for sure is that coronavirus is distributed by respiratory droplets that are excreted by people when they cough, sneeze, talk, or merely exhale. So these droplets can be transmitted through your eyes, your nose, and your mouth. And in case you didn't already know, this virus is extremely contagious and even more contagious than the good old flu. So most of us have seen the coronavirus, seen what it looks like, right? And if you haven't seen what it looks like, you'll see now. So those little spikes that you see sticking out, those attach to the respiratory cells, and that's how they get inside the cell. And once they get in there, they get to the center of the cell, which is the nucleus, which is like the brain of the cell, and they bind to the DNA, and they change the cell from being a respiratory cell into being a virus cell, and it just keeps multiplying. So instead of the cell being able to take in nutrients and oxygen and all that great stuff, now the cell becomes a slave to the virus and starts making new viruses within the cell until it bursts and starts attacking neighboring cells. Initially, the coronavirus will affect the upper airways, which is the area above your vocal cords. So depending on your immune system, you may be able to fight it off the virus and recover in a couple weeks. You may, as in 80% of the cases, have mild symptoms like a dry cough, stuffy nose, fever, and body aches. That's it. But in other cases, the virus spreads down to the lower airways and attacks the lungs, which sets the stage for pneumonia or inflammation in your lungs. Now, pneumonia causes the air sacs that usually would send oxygen to the blood and remove carbon dioxide from the blood. It causes them to fill up with mucus and fluid, which makes it very difficult to breathe. So in the most severe cases, unfortunately, these people will have to be put on ventilators, machines that breathe for you. That's what happens in the worst case scenario. The other problems that can be caused by this is that a lot of times asthmatics are on oral steroids like prednisone to help control their asthma attacks. So I will tell you, when I have an asthma attack, that's one of the first lines of defense that the doctor will put me on is they'll put me on steroids. And that usually snaps me right out of it. And they put you on a weaning scale. So you might take 4 pills on one day, but by the end of it, you're on 1 pill and then you don't take them anymore. Well, they have found that oral steroids can increase the viral replication, which means the virus multiplies more when there's steroids in your system, which of course would put you at higher risk for having a bad outcome with COVID-19. And another concern is those people who take steroids regularly, in addition to asthmatics, but there's other people that have to take them. Sometimes the steroids can make it hard for the body to have a normal stress response. So when the body usually feels sickness inside of it, it goes to attack. But if you're on steroids, your body may not go to attack. So then that makes you even more susceptible to COVID-19. The one thing that we didn't talk about is, what is the difference? How would you know, right? So some people could be having an asthma attack. Some people could have COVID-19. You could have the flu, but we don't know. So whereas those symptoms would be an asthma attack right away before, now everyone's like, well, what is it? We don't know. So now it's causing you to have to go to the urgent care or the ER because you have to be tested. You have to have some sort of chest imaging because that's the only way they can tell what actually is happening. I want to make sure that I tell you how we can prevent this from happening, right? So the way that we're going to protect ourselves from COVID-19 as asthmatic, we're going to stay at home as much as possible. Avoid being exposed. People who are sick right now, consider seeing your doctor via video visits or phone calls if you have a routine health issue. If not, you definitely should go to the hospital. Practice social distancing. I'm telling you that 6 feet distancing, staying with people that you know, no large crowds with your family, it works. We've seen it in other countries, it works. Wash your hands frequently, soap and water for at least 20 seconds. Say your ABCs, or you can sing happy birthday twice, especially before eating and anytime you're going to touch your face, and especially after going to the bathroom. So if you don't have soap and water available, you know you can always get you some good old hand sanitizer and you'll be good to go. You want to be kind of obsessed with cleaning. Frequently touched objects, doorknobs, refrigerator doors, light switches, keyboards, toilets, faucets, sinks. Clean those often and make sure you avoid disinfectants that can cause you an asthma attack. Be careful. Now, this is a tricky one. Most people are like, why? Stay away from alcohol and smoking. You know why? Because there's cilia that lines our nose that literally is the first line of defense. If something is to come into your nose, that cilia will try to push it out. Well, they say that alcohol and smoking can paralyze that cilia so that it no longer sweeps out viruses and bacteria. So to keep asthma under control, people with this condition, you are urged to at least have a 30-day supply of your medication on hand. So whatever your medication is, make sure you have that on hand. And I do know that these inhalers, they're a quick relief and a rescue medication used to decrease asthma symptoms, but they've actually been using them also for COVID patients. So in some parts of the country, it is kind of hard to get one. So please make certain that you try and get yours when you can get it so that if something happens, you're covered, okay? Then, you guys, the last thing I want to tell you is when you go out, wear your face mask. That's the proper way to wear it. Over your nose, over your mouth. This is one of my favorites because nice and snug, but I have several. Because face masks are the new accessory. My face masks have all a message. This is my school. I am a unicorn. I'm a Black female doctor. And this is my country, Antigua. So, wear your face mask. Have you been protecting yourself from COVID-19? So if you're an asthmatic, have you been protecting yourself? And if you're not an asthmatic, have you been protecting yourself? So why don't you tell me about it below, and I'll be in the comments and I will comment and reply. But I can't wait to hear how you've been protecting yourself from COVID-19. Because let's face it, asthma or no asthma, you don't want to have COVID-19. Now you know exactly how COVID and asthma kind of go together and really don't go together. So now you've learned a lot about that. But if you would like to learn more, watch this video here. What is asthma? And then you can watch this one here. This is a video YouTube thinks that you would like to watch of mine. So check it out. Bye.